From January 1st, dozens of international NGOs, including Doctors Without Borders and the Norwegian Refugee Council, must follow new Israeli registration rules. They are required to fully disclose staff details, funding sources, and operations. Aid groups say these demands are unrealistic, especially after more than 500 humanitarian workers have been killed by Israel in Gaza.
So the issue of NGO registration is extremely critical. Our international NGO colleagues and partners are an indelible part of the response, and the contribution that they are making in every aspect of the response is extremely valuable. If we look at healthcare, for example, they run or support around 60% of field hospitals alone.
Local groups are working with international NGOs to keep services running, but these new limits could leave critical needs unmet.
Israel aimed to silence these organizations, and at the same time to deepen the humanitarian catastrophe through this order by the Israeli occupation authorities. So many thousands of people who in need for surgeries will be left for pain and death.
Even after a fragile ceasefire agreement, access to healthcare and basic services in Gaza remains limited. Aid workers warn that cutting international support could leave thousands without medical care or essential supplies.
These 37 organizations being shut down will affect us badly. Health services and medical supplies depend on aid from outside Gaza. Access to food, emergency aid, and other basic support will also be severely limited.
After March 1st, banned organizations will no longer be allowed to bring in supplies or staff. They will only be able to use what is already inside Gaza. Aid groups warn this could undo any progress made since the ceasefire. Hundreds of thousands of Palestinians still live in tents after losing their homes during Israel's war on Gaza. Health, shelter, and water services depend heavily on international aid groups. Local organizations are doing what they can, but the needs in the enclave far greater than their capacities. Abdul Wahab Hamad, TRT World, Central Gaza.